Blog Talk Radio.
Welcome to Women Who Rock with Success, which is an award-winning show for professional women. We profile a collective of amazing women who are thriving to build their brand. Women are handpicked in various fields who can provide credible information to build your business and lifestyle. We are live each Thursday at 9 a.m. Central Time, followed by our latest brand, Women Who Rock Investigates. To learn more about us, go to our website at www.womenwhorockwithsuccess.com. Now, let's join our podcast host in the studio, Mrs. Diane Winbush.
Good morning and welcome to Women Who Rock with Success. Thank you so much for tuning in on our 9 o'clock a.m. segment. Today we will be sharing information, and we have a guest that's on the show that will be sharing information in regards to facial cosmetic surgeries. And so, and I thought this was kind of compelling to the audience simply because of the fact that, especially when women get in the age of 50s or something like that, they are always looking for some sort of age regimen to be able to correct their skin. And so this is something that will be beneficial for all the genres that we serve here on Women Who Rock with Success. So our guest speaker this morning will be Dr. Daria Hamrah, and he's going to be able to share some information with us in his profession, in his field, his occupation, and we're going to be able to go from there. So good morning, Dr. Hamrah.
Good morning, Diane. Thanks for having me.
Okay, you are welcome. So let's get right into the meat and potatoes. So tell us a little bit about you and what compelled you to be able to come into this field. And I'm pretty sure I see women a lot on your sites, but I'm pretty sure it may be open to men too, I guess, if that's something that they wanted. So what compelled you? And tell us a little bit about you. Kind of back up a little bit before you became a doctor and tell us a little bit about you and then lead up to as to what thrived you into this occupation as a surgeon.
Sure. Basically, I'm a facial cosmetic surgeon, so my job entails making men and women. About 85% of my patient population are women, but also I see men. To basically make them look better and make them look how they feel. So. And also, as far as anti-aging and aesthetic medicine, the way I help my patients is to give them basically their self-esteem back and self-confidence back. So I call myself more of a self-esteem and self-confidence doctor than a facial cosmetic surgeon, because that's just a tool through which I help my patients. And many patients come to me with requests to improve their facial appearance, and the reason why they are not happy with their facial appearance is because obviously they have a certain expectations as to how they should or want to look. Just like you put on a certain makeup or wear a certain dress or clothes on, you do that to boost your self-confidence and self-esteem. It's all at the subconscious level. People, they do it as a normal thing when they wake up in the morning, put on makeup and wearing their favorite dress on to go either to work or to a party or to the mall. It doesn't matter. So obviously it's important to people. Their self-image is important. But also, interestingly, as part of human psychology, it's important how others see us. And it's important to us. We constantly look for approval. And that's why we always seek to look better and also feel better. So those go hand in hand. So the way where I come in is to help them to improve their looks and appearance based on what their wishes are. For example, someone that has they're not happy with the appearance or the size of their nose, wants nose reshaping, or they feel they have droopy eyes and eyebrows or eyelids, and they say, people always come to me and say, hey, you look tired, or why are you sad? And they don't feel sad, they don't feel tired, but when they look a different way, it bothers them, and also it bothers some people constantly asking that question. So a lot of patients come to me with that, and patients, of course, that due to aging, they have unwanted wrinkles or jowling or droopiness, and they just want to look better, and because they don't feel that old, and they look in the mirror and they feel they see themselves, and they go like, gee, I kind of look old, but I don't feel old, and that discrepancy bothers them. It bothers them. They want to do something about it. And interestingly, in the past 10 years, this health and fitness awareness, as it has increased, more and more people just want to also look better, look the way they feel, because in general, our population's gotten healthier because of all those health conscious and diet conscious behaviors and habits that are being created as we speak, and which is amazing. I mean, in the past 10 years, I feel there has been a health revolution going on in America and the Western world. Now, but let's dial back and how it all started. So I actually grew up in Germany, and growing up in Germany as a son to Persian parents, obviously I was always the black sheep in the crowd, and everybody was like taller, everybody looked different, and so I always had this chip on my shoulder, and I always had these was in conflict with my self-esteem and self-confidence, because when you're a child or teenager growing up in an environment where you look different and everybody looks at you differently, you grow up with a different type of self-awareness and self-consciousness, and your challenge, your self-consciousness, your self-confidence is just challenged on a daily basis. And so I grew up with that awareness, and I became very sensitive to that issue. And that's why today I feel I have a great understanding for my patients. I have a lot of empathy for my patients that come to me with those concerns, as opposed to being dismissive or telling them to grow up or get their act together. It's not like that. It's not that easy. It's a growth. And where I come in, I help them in their journey of their self-growth and self-confidence. So I'm just to help. I tell my patients, I'm not going to fix your problems, but I can certainly help you to along that journey, to be part of that. And but ultimately, it has to come from inside. It takes more than just. So that's how everything started. And the way I got into facial cosmetic surgery is a long story, but to make it short, my father was a physician, so I grew up in a healthcare environment. I always admired, he was an internist, so I always admired him when I went to his office, how grateful his patients were to him, how he, with the care and empathy he treated his patients. It was very inspiring to me, and I always wanted to do the same. And I actually wanted to become an eye doctor always, and just because I was at the eye doctor a lot as a kid wearing glasses. And and once I got into medical school, I realized, gee, that's boring. It doesn't really fulfill my artistic needs. And my mom was an artist, so I had those chromosomes from her, and I actually double majored in arts and biology, and I think that urge, or that I would say that urge got me subconsciously into the field of reconstruction and improvement or enhancement. And I remember my first clinical lecture in medical school, I was sitting in a huge lecture hall. It was like 100 students, and one of my professors come and shows a picture of an infant, a newborn, with a cleft lip and a cleft palate. And I was terrified. I remember that day vividly, like it was yesterday, and sometimes I dream about it. I was so shocked to see a newborn debilitated, and I felt so sorry. I felt actually disturbed and upset. I'm like, why would God create a newborn like this? This is just not fair. And as I was going through all these disturbing emotions, he showed me the after picture after the surgery, how he repaired the cleft lip and a palate. And I thought I saw Jesus. I thought, man, this guy is a saint. Like, he just gave that baby a new life. And so I was so inspired. I said, I want to do this. I want to learn how to do this, and that's what I want to do. So my passion for facial cosmetic and plastic surgery really started then, and it changed my career path at that moment. And I just posted a post on my Instagram a week ago. It was my 22-year anniversary coming to the United States from Germany, where I started my path. And now, 22 years later, I have, together with colleagues and friends of mine, we created a foundation for cleft lip and palate surgery to help children in South and Central America in need for cleft lip and palate surgery. And our foundation is called Alegría. Alegría in Spanish meaning joy. It's called Alegría Foundation for Cleft Lip and Palate. And you can check us out on @Mission Alegría on Instagram or Facebook. But so that's 22 years later. We're in our 6th year of running our foundation, which is just a mom and pop foundation that we created. We use our own resources, and whoever comes and helps us and wants to volunteer, we take. Now, due to the pandemic last year, we couldn't go, but we're going to start again next year.
Okay, great. So now, when commercials, people have different types of commercials. You have different types of facial surgeons, and a lot of times people may want or desire some type of facial surgery to be able to correct any type of imperfections that they may have in their skin, or any type of imperfections that they may have. You know, sometimes people think, well, my nose is too long, or my nose is too wide, or what have you. So what is Botox? Explain that to the audience as to what that actually is and what that entails, so we can kind of take the fear off of that from some of the individuals that want to be able to do it.
Sure. So I'm going to answer that question first, and then I'm going to dial back and go to your beginning of your question about imperfections and patients' perceptions as to what they would need. So Botox is basically what we call in medical terms a neuromodulator, meaning it modulates and modifies your neuron activity specifically as pertaining to your muscles, your facial muscles, or any muscle in your body, but obviously we use it we're talking about the face here. So it modulates and weakens, essentially, by blocking receptors on your facial muscles, the movement of your muscles. Now, those could be completely, and that's dose dependent, those muscle movement could be completely eliminated, meaning paralyzed, or partially based on how much movement you desire. And that requires, obviously, expertise to know how much into what muscle to achieve what result. But in short terms, basically, it weakens your muscles, so you move them less, because certain people, and not everybody, they have very dynamic and very strong muscle movement, which then create deep lines, wrinkles, and folds within your face that over time become permanent within your skin. So Botox basically avoids and prevents that, which means, and now listen carefully, it's meant for prevention, not necessarily for treatment. So Botox is more of a wrinkle prevention or preventative treatment. It doesn't really lift things up, or it doesn't replace having surgery. It's actually more for maintenance. Also, the other side effects of Botox is it smoothens your skin. It shrinks you by shrinking your pores in your face. So it just makes your skin also smoother. Other applications of Botox that are used on and off label are for migraine headaches, for example, or patients that clench their teeth so Botox is injected into the jaw muscles to weaken those muscles so you can clench and you don't get facial pain or TMJ issues. It's used for even rosacea, which is like a redness of the skin due to enlarged tiny blood vessels. It shrinks those blood vessels. Studies have shown I use it for that. It's also used for sweating, people that sweat a lot, you know, whether it is in your forehead or your face or your scalp, or it's in the palms of your hands or armpits, you know.
Okay.
So I have a lot of men come for that. A lot of businessmen, you know, they're reluctant or self-conscious about shaking someone's hands because they have sweaty hands. And, you know, you inject a little Botox into the palms of hands and start to sweating. So it's a very, very versatile agent that treats many conditions.
Okay, great. So rosacea, Botox can correct rosacea. Okay, I've never heard of that.
Yes.
But thank you so much for bringing that out. I've never heard of that because I've seen the women with the rosary cheeks, and some men have it too. You know, but the population is more with the women than it is with the men. And I'm like, okay, then it seems like you've been out in the cold too long, but it's actually like some sort of skin imperfection that they may perhaps have. I didn't know it was a treatment for that. So guess what, audience, you're listening. Okay, it's a treatment for it. So we want to talk about the statistics of how much women spend on cosmetics. And so for years, of course, people have always have stated, you know, you hear news reports, you hear statistics, and they say that cosmetics is a contributor to women's skin actually sagging. The powder sponge that sometimes women use, sometimes it's the foundation. If it's used over a period of time, perhaps 10 or 15 years, this can cause the women's skin to sag, and the cosmetics may have some type of solution or ingredient in it that's going to cause them to age over time. So we want to talk about that. We want to eliminate the theories as to what people have said versus, you know, especially with your profession that you have as a surgeon in regards to that. So women will not be afraid, okay, I'm going to I'm going to apply the makeup from the age of 20, but when I get 40, I'm going to stop because I don't want any wrinkles. So we want to kind of eliminate the theories as to how a makeup can or cannot, or is it just something that, like I said, a theory that people have always carried in the news and other statistics of makeup and how it can be able to improve or degrade the skin for women.
Yeah, so let's talk about facts so that people understand these theories better. You know, once you know the facts, you can basically understand what theories make sense and what don't. So basically, when you apply makeup to your face, you have to understand what you're doing. So, of course, the purpose is to cover up imperfections, create certain light reflections and shadows within your face to basically create a certain contour. You can contour your face or give the illusion of a contour by using makeup. It's like art. It's like painting a face on canvas, and all you're using is different shades of paint, and it creates a three-dimensional image that is actually on a two-dimensional surface. So you're giving a three-dimensional illusion. So that's what makeup, first of all, is. Now, when you put makeup on your face, the reason why you put makeup on your face to give those, to create those shadows and light reflections to basically enhance your appearance. And if you have flat cheekbones, for example, you create more of a shadow underneath your cheekbones, which will then give the illusion that you have larger cheekbones. And on top of your cheekbones, you create a lighter shade, which creates the illusion of a light reflection. So the combination of the light reflection and the shadow create an illusion of a beautiful cheekbone. Now, you can do it with makeup, but you can do it surgically or non-surgically by enhancing your cheekbones, so you don't have to put that much makeup on to create that illusion. So it's already naturally or actually surgically enhanced given, so you have to use less makeup. Okay, so that's where I help patients to basically avoid or prevent putting on makeup or too much makeup. The reason why we hear that makeup is not good is very simple. Anything you put on your face, you put on your skin. What you're doing is you're closing and clogging all the pores of your skin, and so your skin basically can't, in layman's terms, basically breathe. So when your skin can't breathe, and the cells that contribute to the vitality of your skin, they will be compromised, and that would then take you down the path of accelerated aging of the skin. So that's the unhealthy part of makeup. Now, there's different types of makeups. Now we have like mineral-based makeups, and they're a little better for your skin. But in general, you have to understand, by putting on makeup, you're putting chemicals on your face. And anything you put on your face, your cells have to defend themselves, your skin has to defend itself, and that contributes to accelerated aging. Now, so that won't necessarily contribute to sagging, but it contributes to making your skin dull and just creating more fine lines and wrinkles and losing more collagen. And our skin is basically made out of collagen, so you don't want to lose collagen. We're already naturally losing collagen as we age. With makeup, we accelerate that loss. Now, what happens when we take off the makeup? So every day after we put on makeup, we have to remove makeup, correct? So we take all these wipes and we start wiping it off. And every time we wipe, we have to apply a certain amount of pressure to our skin to wipe it off. And that constantly stretches the ligaments that are underneath the skin and attach your skin to the muscles underneath your face, as well as the muscles to the bones, to the facial bones that are underneath. So you're constantly wiping and stretching these ligaments, and anytime you stretch a ligament constantly, it becomes longer, and then gravity will have more of an effect on your face, and gravity goes typically downwards, and that's why our face starts sagging downwards, because the ligaments are stretched. They can't hold our face up as they used to, and that's the constant wiping and massaging the face. And so that contributes, in addition to the facial aging of the skin, also to the droopiness and sagging of the facial skin and the muscles.
Okay. So, but that won't have anything to do with, like, if a woman goes to a spa and get an actual facial. Would that be something different, or would that be on the same type of, I guess, neighborhood of stretching the skin also?
It depends on the experience of the esthetician. You know, they're trained to not to apply too much pressure on the skin. So, you know, and it's not something that we do daily. I mean, people don't get facials every day. They usually get it once every other month, like every 2 months they get a facial, right? So that really won't have that effect. You know, what has effect on our aging process is the things that we do on daily basis, not couple of times or 4 or 5 times a year. Those won't have effect. It's just the things that we do on daily basis, and in that context is the constant wiping off and applying makeup. Not getting a facial every other month.
That's fair enough. And so women can be able to understand the difference between the two, and then they can also kind of make some modifications in regards to how they apply it and how often they perhaps maybe apply makeup to their skin. So
and also when they wipe it off, not to apply too much pressure and don't stretch the skin too much. So be gentle.
Wow, that is awesome right there. So now we're still learning. We're in school learning about, aesthetics and cosmetics and what have you, and how to apply and how to remove. So we want to talk about Hamrah. We want to talk about Hamrah Aesthetics. So the product line that you have, share with us a little bit about that and the difference of, okay, so we see age-defying, of course, and we know what that is off top, but the hydrophill and the aloe. Kind of share a little bit about that, about the aloe day cream, because women, I'm telling you, I know some women, they put all types of things on their face for morning, afternoon, before they go to bed, and they have to cleanse and what have you and things. So kind of share a little bit about that with us.
That's a great question. So the skincare is a very specific and should be a very customized treatment regimen based on your skin type, color, and age. Okay, every skin demands, based on those factors, a different regimen. Just like every medical condition that is treated doesn't use the same drugs. You don't take Tylenol for every medical issue, right? So you might take it for a headache or something, but if you have rosacea, for example, talking about rosacea, Tylenol doesn't help it. So as far as skincare, we still have to learn a lot, because we have to kind of retrain. We have to retrain ourselves. Traditionally and still today, when someone needs to take care of the skin, one day they wake up, they don't like the wrinkles. They say, maybe I should take care of my skin now. Until now, I didn't even put sunscreen on. I actually put tanning oil on to tan, but now my skin looks old. Let me get into the skincare thingy. So what do? They ask a friend, a sister, or a neighbor, or they just go to Neiman Marcus to the cosmetology department and just ask for some skincare lotion that is anti-aging, and then the choices that they make or what they're being offered is completely arbitrary. If you go to a store, you're going to be given something that they want to sell off their shelves and something that they're promoting right now, which has nothing to do with what your skin actually needs. Or when you ask your sister or your girlfriend, they're going to tell you what might be working for their skin, but their skin is different than yours. So they might be giving you Tylenol because they have a headache, and you're asking for medicine for rosacea. And then they like, take Tylenol. I take Tylenol. It works great for me. So that's where the confusion lies. And then most women end up spending thousands of dollars on products that they never end up using. They just sit in their closet because they put it on and didn't do much. They're like, well, that doesn't work, because no one actually taught them also the other things, what to expect, and the other things that you need to do with it. For example, I have women, they spend thousands of dollars on skincare products, and they never had a facial. And so these skincare products, they can't even penetrate and go to the deep layers of the skin where they're supposed to work. And then they wonder why none of this is working. So there has to be a lot of education, and the only way you can get the education is if you go to a doctor or an esthetician, and then once you get on that, you have a better understanding, you can make better choices. So for me, as someone that has his own med spa and I have my own master esthetician, being a facial cosmetic surgeon, I obviously can't ignore the skin of my patients, and I have to take care of that as well, especially since I'm doing a lot of laser resurfacing and chemical peels, and those require also a skincare regimen before and after the treatment. That's how I got involved deeply into skincare. And I was kind of from different companies, trying to get the best products and ingredients. And it ended up being a mismatch of a bunch of different products and brands that it got really confusing. So one day I realized, well, I know what ingredients I want. Why don't I just have a company help me to make the products that I want, that I know works, and I don't have to mix and match and constantly worry about it. And also it's less confusing for my patients. So kind of streamline it a little bit, create a system where it's also easy for my patients to kind of comply with. you know. And another thing with skincare has to do also, it has a lot to do with discipline. You know, you have to be disciplined to maintain a certain regimen. But if I give you a super complicated regimen, I don't care how disciplined you are, you're not going to do it. So all of these challenges, they brought me to starting my own skincare line, which is not actually meant for it's not for me. It's not even a good business proposition, honestly. It's just that it makes my life easy. But anything that makes my life and my patient's life easy is a good business proposition, because as long as I solve a problem, that's a good thing. So that's why I did this. So as to, you know, specific products that you mentioned, like the Aloe Daily Day Cream, that's one of my favorites, because especially now during the winter time that's coming up here in Washington, D.C. areas where I practice, it gets really dry and cold here. And even with my skin, which is, I have a little darker skin, it really gets dry and choppy, and it doesn't matter how much moisturizer you put on, it gets choppy. So the Aloe Day Cream is a great moisturizer that I use for myself. In addition to whatever moisturizer you use, you can apply to your skin anytime it feels dry, itchy, or red. It really soothes and calms it down immediately, and it's one of our best sellers. I mean, I met a lady, I didn't meet her, but I was in Starbucks at the mall, and this lady was taking stuff out of her purse. I think she was looking for her wallet or something, and then she took a couple of stuff out of her purse and put on the table to find her keys, and I saw my Aloe Day Cream. I'm like, oh my God, where'd you get that? And apparently she had gotten it from our online store, because like I said, remember I said people ask her sister. Her sister is one of my patients, and she had recommended it. You know, with the Aloe Day Cream, you can put it on any skin. It's you know, everybody knows aloe vera, and so it's very, very good for your skin. But to going back to your initial question, you know, or comment about people using tons of things on their face, from serums to different type of creams and ointments. Remember, as long as it's customized and it serves a certain purpose, it's a good thing. But again, if you make it too complicated, it's hard to keep track and be disciplined and actually, you know, do it the right way. So my skincare system kind of keeps things simple. Gives you when our patients come here, I analyze, and my esthetician, we analyze your skin, and we create a custom treatment for your skin, and based on also results. So you come back and we have a follow-up. So we want to make sure that, you know, we don't have to fine-tune things. So follow-up care is also important, because it's not like a cookie-cutter thing. And that's why I always recommend people, don't waste your money on these skincare stuff that costs so much more money, and it's completely arbitrary. It might not even be for your skin or your age. You know, and have a proper professional look at your skin, customize a skincare regimen, and also a follow-up care, meaning to optimize it. Things have to be optimized. You know, I have to take my car to the shop to tune it once a year, to change the oil. I mean, it doesn't run itself. You know, how do we expect our skin to always be great and beautiful? So we even go to the dentist every 6 months to get our teeth cleaned, despite brushing our teeth every day. But that paradigm shift hasn't really kicked in when it comes to the skin. Right. Ironically, the skin is the largest organ in our body, and that's the irony of it all. So I think we're slowly learning to take care of that.
Okay. Great. So we have learned so much, audience, from Dr. Hamrah on today. We learned about aesthetics and his practice. We've also learned about his skincare product line, and then we've also learned about how to apply and not how to apply makeup, and of course, with the wipes and what have you. I know I have learned an entire bunch. So when I, perhaps later on, I'm going to make sure that I'm taking all of these notes down, and hopefully that you are too as well. So Dr. Hamrah, with the last statement, just let the audience know how they can be able to follow you, get in contact with you with your website, any publications or books that you have published. You can be able to share that at this time with the audience.
Sure, absolutely. So the best way to get a hold of me is on my Instagram at Dr. Hamrah, or on TikTok, Real Face Doc, or on Facebook at Nova Surgicare, or just simply reach out to me on my website. My phone number is there at www.novasurgicare.com. Nova, N-O-V-A, and then Surgicare. And also I'm on LinkedIn and all the other outlets. You can pretty much find me on any social media outlet. And I handle all of them personally, so when you DM me, I'm actually the one responding to you. I don't have a social media team or something that does things on my behalf. And the reason why I do that is because I want to understand more and learn more about your concerns, and the only way I can do that is if I communicate directly and there's no middleman. And I've learned so much from my patients' requests, challenges, fears, concerns, that is the single most important reason why I had to up my game the way I have. And so that's why I'm very grateful for anybody that reaches out to me and trusts me. As to my publications, they're usually most of them are medical journals, and I just wrote 4 book chapters, 2 on rhinoplasty, 1 on facial aging, and 1 on facelift in a large international 6-volume plastic surgery textbook that is mostly meant obviously for doctors and surgeons from all over the world. But if you are like some plastic surgery buff that wants to read a textbook, it'll be soon published, and I will announce that publication on my social media. Also, I have my own podcast, the Daria Hamrah Podcast, and if anybody wants to be a guest on my show, and it's about business entrepreneurship, you're also welcome to be a guest on my show.
Awesome. So once again, we thank you for being our guest on today, and I'm pretty sure that the audience and the listeners have learned so much. I know that I have in regards to cosmetics and the skincare and what have you. And so we just thank you once again for being our guest on today. And so listeners, you know where to go. You can find us on Facebook in order to learn a little bit more as to who's going to be the next guest on the show, as well as our Instagram page at Women Who Rock with Success. So for everyone take care, and thank you once again, Dr. Hamrah.
Thank you, Dan. Thanks so much for having me. It was really fun.
Okay.